Enoxaparin sodium syringe is used to prevent and treat harmful blood clots, which can reduce the risk of stroke or heart attack. It works by lowering the activity of clotting proteins in the blood, helping to keep the blood flowing smoothly. This medication is also known as an anticoagulant or blood thinner, and is often used in conditions such as certain types of surgeries, long periods of immobility, certain types of heart attack, and unstable angina. In some cases, it may be used in combination with other blood thinners. The dosage and timing of administration will be determined by your healthcare provider based on your specific medical condition. Before starting to use enoxaparin, make sure to read the patient information leaflet provided by your pharmacist. This medication is given by injection under the skin, usually once or twice a day in the abdomen. The dosage and length of treatment depend on your medical condition and response to treatment. It's important to use this medication regularly to get the most benefit from it. If you are using this medication at home, be sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before injecting each dose, make sure to clean the injection site with rubbing alcohol. It's also important to change the injection site each time to lessen injury under the skin and to minimize bruising. And remember to learn how to store and discard medical supplies safely. This medication may also be given by injection into a vein by a healthcare professional, as directed by your doctor. Some common side effects of using enoxaparin sodium syringe may include mild irritation, pain, bruising, redness, and swelling at the injection site, as well as fatigue or fever. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of potential side effects. While many people using this medication do not experience serious side effects, it's important to be aware of potential risks. Enoxaparin sodium syringe can cause bleeding if it affects your blood clotting proteins too much. It's important to seek medical attention immediately if you experience any serious signs of bleeding, such as unusual pain, swelling, or discomfort, as well as prolonged bleeding, easy bruising, dark urine, black stools, severe headache, confusion, vision changes, dizziness, fainting, seizures, weakness, or numbness. While a severe allergic reaction to this drug is rare, it's crucial to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of all possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Remember to always consult your doctor for medical advice about any side effects. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you may report side effects to Health Canada at 1-866-234-2345. If you are using enoxaparin sodium syringe, it's important to be aware that there is a risk of bleeding near the spinal cord after certain spinal procedures. This type of bleeding can lead to long-lasting paralysis or even permanent paralysis. Therefore, it is crucial to discuss the benefits and risks of this medication with your doctor before undergoing any spinal procedure. Your doctor may advise you to temporarily stop taking this medication before and after the procedure, so it's important to carefully follow their instructions. It's important to note that the risk of bleeding may be higher for individuals with a deformed spine, a history of spinal procedures or surgery, or those taking other medications that can increase the risk of bleeding or bruising. This includes drugs such as clopidogrel, warfarin, rivaroxaban, or nonsteroidal anti-inflammatory drugs like ibuprofen. If you experience symptoms such as back pain, leg numbness, tingling, weakness, or loss of control of the bowels or bladder, it's important to contact your doctor immediately. As always, it's important to take this medication exactly as prescribed and to discuss any concerns or questions with your healthcare provider. Before using enoxaparin, it's important to discuss any allergies you have with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to get all the details from your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have artificial heart valves, kidney or liver disease, bleeding problems, high blood pressure, or have had recent surgeries or procedures. While taking this medication, it's best to limit alcohol intake to reduce the risk of stomach bleeding. And before any surgery, make sure to inform your doctor or dentist about all the medications and products you are using. To avoid the risk of cuts and injuries, be cautious with sharp objects and avoid contact sports. Older adults may be more sensitive to the side effects, especially bleeding. If you are pregnant, only use this medication if it's absolutely necessary, and discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it's not known if this medication passes into breast milk. It's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Enoxaparin sodium syringe may interact with a drug called mifepristone. It is sometimes used together with other drugs that have blood thinning or antiplatelet effects, such as aspirin, clopidogrel, or warfarin. If your doctor prescribes these combinations, you will need closer monitoring to minimize your risk of bleeding. Make sure to keep all medical and lab appointments. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers, NSAIDs such as ibuprofen, naproxen, or aspirin, which can increase the risk of bleeding/antiplatelet effect when used with enoxaparin. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, usually 81 to 162 mg a day, you should continue taking it unless your doctor instructs you otherwise. Ask your doctor or pharmacist for more details. Remember to always follow your doctor's instructions carefully and ask for more information if needed. If someone has taken too much enoxaparin sodium syringe and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include excessive bleeding and bruising. Always seek immediate medical attention if you suspect an overdose. It's important not to share this medication with others. Your doctor may also require you to undergo lab tests or medical tests, such as a complete blood count or anti-factor XA blood levels, while you are using this medication. Be sure to keep all of your medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. When storing enoxaparin sodium syringe, make sure to keep it at room temperature, away from light and moisture. It's important to not store it in the bathroom and to keep it out of reach of children and pets. If you're using the multiple dose vials, make sure to not keep them for more than 28 days after the first use. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it's expired or no longer needed, and consult your pharmacist or local waste disposal company for the proper way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.